Our next speaker is Dr. William Ray. He's well known to the Academy. He is a cardiovascular and general surgeon and the founder and director of the Environmental Health Center in Dallas. Winner of many awards and a prolific author. Today he's going to talk about the role of mitochondria in health and disease.
All right, well, I'm going to talk about something that I have intimately been related to for the last 40 years, and that's the mitochondria and the not only the energy production, but also the programmed cell death, which we see often as trauma surgeons and cardiovascular surgeons, but all you people see it too, but you probably don't think about it. And that's the fact that when people come into our office, almost all of them are tired. And I would assume that that's true in your office also. And they just can't function very well, and they can't program their brain very well. They get sort of fogged, brains fogged, short-term memory loss, balance issues, and so on. And now, so the other thing you have to look at is apoptic signaling. And there are about 50 to 70 million cells that are sick or dying each day. Now, I challenge you to think about that a little bit, because your patients really are sick when they come in. And so about the last 10 docs have said that they got brain dysfunction and that they're psychosomatic. Well, they got brain dysfunction, but they're not psychosomatic. That's the whole point. And the point is, how do you differentiate the two? And how do you realize that when you start getting those people better, that you have to be careful, because sometimes they'll start getting better and then they'll crash. And they'll get better and they'll crash. And what this appears to be is reperfusion injury. And all cardiac surgeons know that if you give the wrong oxygen at the wrong time and open up a vessel, you may have reperfusion injury. So think about this a little bit, that a lot of these patients are getting suddenly a burst of oxygen from the arterial spasm that's being relieved. And when the arterial spasm is relieved, no matter how small that vessel is, you may get reperfusion injury from it for a little bit. So you want to get the oxygen there, but on the other hand, you want to get it there in a gentle form so that the patient doesn't get too sick as the little blood vessels are opening or the new blood vessels are forming. Okay, now, mitochondria also is famous for giving inflammation if this happens. And so there's such a thing as sterile inflammation. And it's seen in the chemically sensitive patient all the time. And this is one of the reasons that appears to make them sick, along with the most common things, which are natural gas and pesticide. And this hotel happens to be full of pesticide right now. And so you're all getting, if you're getting your vessels open, you're getting damage from the pesticide and the small blood vessels because of that. Now, there are many other substances. They call it, the farm people get hit by herbicides all the time, and their uniform grasses will cause problems in the families that live next to that area, and of course, the people that eat herbicide in food. Yes, it may be small at one time, but it occurs over and over and over again as you eat commercial food, and therefore you will get inflammation, you'll get mitochondrial damage. The other thing is the people who live near freeways and like this hotel, or people who work near these areas, you will have oils, solvents, car exhaust, and so on that'll cause mitochondrial dysfunction from the inflammation. Then another category that occurs, and one has to look for it all the time because there's an epidemic in the United States of it, and that's mold toxins. And mold toxins, mycotoxins, are epidemic in all these hurricane areas where the houses leak. And how many times have I heard coming in, "Oh, Doc, it's just a little leak," and we know that there's mold been there for 15 years, and how your family been? Well, they were okay, but then they got worse as time went on, and we finally had to move out of the house because of this mold leak and mitochondrial leak. And then you hear other people who say, "Well, we cleaned this up, so there can't be any mycotoxin in the house." Well, you can clean a house of mold, but boy, I'll tell you, to get a house clean of mycotoxin or a building clean of mycotoxin, then you got problems. So there's this coherent problem that even electromagnetic frequencies can call it. Now, I see some generators in this building right now, in this room, in the fact that there is a few computers there. And these computers can cause electromagnetic coherence and cause similar problems than other people. And then I see people with cell phones. And of course, there's no question that the cell phone can cause the inflammation, cause the mitochondrial leak. So all of these kind of things, in addition to our perfumes and, terpenes. Everybody know what terpenes are? Now terpenes are the odors of different plants, and there are, I've lost track of how many terpenes there are. I've got it in my new book, so you can look in that and see, but there are tons of terpenes that can cause this. These are actually the second most common natural substance besides natural gas. And pine trees and different cedar and just on and on of different substances can cause normal terpenes, which can cause sterile inflammation and cause mitochondrial weakness. So if you realize this coherence phenomena and apply it to your patients like Mary Ann was telling you to, then you have different problems with it. Oops, I guess this is wrong. Now, what is the things that these things do that cause the trouble with the mammalian immune system? And of course, the big thing is they disturb the innate immune system, which is the dendritic immune system. And of course, the dendrites get inflamed, and then they can cause the innate, which then can cause the problems with the adaptive immune system. Low T cells, high T cells, low or high complements, of which there are 9 components, and gamma globulins, which the only ones you can really do something about are the gamma globulin 1, 2, 3, and 4. They're very measurable now in the laboratory, and you can give gamma globulin, and those people who have a lot of recurrent illnesses every year, recurrent flus, recurrent weaknesses and fatigue, you can actually stop that gamma globulin by giving the gamma globulin. Sometimes several grams injection 4 times a month, and usually a month it'll be corrected. Now, what we always do, one of the big problems with gamma globulin has been anaphylaxis. So we always neutralize them and treat them several times before doing that. Now, number 4, we've got that. 5, metabolic pathways can occur in the inner mitochondrial membranes, okay? So we like to take care of that, and certainly chemical sensitivity can cause that. Now, ATP is shown to be decreased in the chemically sensitive person. The mitochondrial dynamics refer to the movement of mitochondria along the cytoskeleton. So maybe your genetics may be different, but it just makes you more vulnerable or less vulnerable. Total body load, the same principles for chemical sensitivity, okay? Now, regulation and morphology and distribution is caused by tethering of this plus fusion and fusion events. A great example of this was the Gulf War patients that we saw. And these people all and still will complain of fatigue, and they'll complain of, brain function not being very good, getting depressed all the time. And there are other things like that, just explosion, like happened in the Gulf of Mexico with the problems of the oil rig. The fires that are lit in California, people continue to complain of these and show low mitochondrial function. And any areas of massive contamination, like the herbicides and pesticides, can cause it. So there are a lot of things that do it. Now here's the most recent epidemic occurring in this century and occurring in this millennium, and it's going to be occurring more and more over the years because of Wi-Fi towers. Dallas has become so polluted with those, we had to shut down our safe housing because of the coming in the windows and coming in the walls from these Wi-Fi towers. There's so many of them. They're almost on every 2 or 3 blocks. So you have to be very careful. And if you can screen them, that's great. And sometimes you can, and sometimes you can't. We had a doctor come in from Bermuda who couldn't walk in our clinic. And our clinic is 5 times less polluted than the average building and has a room that is relatively free of electromagnetics. And so we had to get her one of these suits that is basically a Faraday cage suit made out of cotton and silver. And she walked in the clinic, had no problems. We could neutralize her and neutralize her for all the electromagnetic minerals and other substances. And she went back to Bermuda, started riding her horses right away, started going into practice, and had no problems. And I just got a email from her that she was just doing great and could do almost anything. So there are a lot of things you can do with the mitochondrial weakness in the due to EMF. There's some big EMF generators coming out of the electrical stations. And if you look at the new electrical stations, all of them have these big generators or transmitters going out of them, okay? Power lines. The other big thing are the smart meters on the house, and you have a lot of trouble getting rid of them because the companies, electrical companies, don't want to pay for a reader to come out. Now, some parts of the country they haven't hit yet, but they're going to hit every part of the country, and you're going to have a lot of problems with the electrical companies on this, quite a thing. Also, just transmitters coming, you have to think about coming from a transmitter at the power line has to reduce the voltage down to from sometimes 500 or 1,000 down to 60, and that can cause problems for some people. Now, we've talked about the symptoms, and the other people talked about it too, and I think the things that I want to bring up is that there's certainly any organ can have weakness and fatigue if you want to look at it that way, if it gets hit. And but the big ones are central nervous system dysfunctions. And you'll see people come in with brain dysfunction, and they'll have loss of balance or short-term memory loss or just confusion, but also they'll have seizures. And I don't know whether, I'm sort of dumb on that because I'm a cardiovascular surgeon, but we have an inordinate amount of people coming in our office now who have seizures with chemical sensitivity. The other thing is cardiovascular. And of course, the end stage of cardiovascular dysfunction is sudden death. There are 17 generators in Hawaii now that are being prepared for World War III, is the government's quote, unquote. And there have been several sudden deaths in the water around those areas where people go swimming and suddenly they drown. Yeah, wow, that's right. That's what I said when I first ran across that. So those are things you want to watch out for. And when the neurologist will tell you they don't know the cause, which usually they don't unless it's a brain tumor, well, then you got to think about this mitochondrial suppressor, and it can get pretty frightening because of the fact that they, on the cardiovascular one and the neurological one, they want to put higher and higher frequency generators, and they even want to put it over the ceiling of a city or town and generate this electrical hit that's based on the coherence phenomena, just like the other things you see. So it's a total body load, okay? And we have already talked about the immune dysfunction, but the natural T and B cells are decreased, the gamma globulins are decreased, and the complements can be either increased or decreased. Enzymes are a big thing that are changed, and you'll have decreased acetylcholinesterase, decreased peroxidase genes, and increased GGT, which I've seen in some patients that are low mitochondria and have this, and you measure GGT, and there it'll be elevated. So it's something you can look into too. And the other thing, which is interesting, the coagulation is changed, and you may have high platelets or low platelets in these people. So that's something else that you can look out for. And of course, oxidative stress is the key, the ROS system, and you'll get the mitochondrial dysfunction. The one thing that hasn't been mentioned in this talks and this is the fact that when an incitant, whether it be EMF or whether it be any type of oxidative stress, due to all the things we've talked about, is that there's a physiological principle of combined protein kinase. And if the protein kinase is combined with the incitant and then phosphorylated, what happens is you increase tissue hypersensitivity at least up to 1,000 times or more. So one has to deal with the incitant hypersensitivity, and that's where your neutralization of both of molds, foods, hypersensitivity, chemicals, and EMF are combined with a total load phenomena. And you have to treat that. If you ignore it, a lot of times you won't get the patient totally well. They'll sort of half-assed get well. You do diet and they get, avoidance and everything. But if you think about it, it's very difficult to avoid everything the way society is today. And so you want to include the hypersensitivity, and I urge all you people who don't learn the hypersensitivity to learn it, or find somebody to work with who can do it, because it's so crucial in getting a person totally well. Certainly drug sensitivity. I mean, how many people do you come in and see now who say, I can't tolerate any drugs, Doc, and not only that, I can't tolerate antibiotics. And what are you going to do if you get an infection? It takes 2 months to get gamma globulin, and it takes 6 weeks to get alpha. And so you can neutralize right away, and a lot of times you can work it. So don't do that. Other people have problems with steroids. They can't tolerate steroids. Well, a lot of our conventional colleagues can't treat anybody without steroids. They got to give them some steroids, and they make them sicker. And then they come in and they say, Doc, I don't understand this. They gave me these anti-drugs like steroids, and I got worse. And the doc said, oh, no, you didn't. And then, of course, tranquilizers, which obviously are overused, not removing the causes and not neutralize them, and our antihistamines also. Then many more. So just remember that inflammation increases with all of these incitants. You've got to find the cause, and chemical sensitivity does occur. Just thought I'd give a case report of a 33-year-old white female who complained of itching all over. And while she was talking to you, she was just scratching like mad. And of course, she had had polypharmacy for this, and peak flow was down, as it always is in these people, which is a simple thing to do. And she was a beautiful gal, and she lost all her hair. She became totally bald. And she looked good in her blonde wig, but when her hair grew back, it was much better. And so we were always like that. And when we neutralized her with the avoidance, one thing, she was super mold sensitive, had a house that was moldy, and we had to be very cautious because her dilutions were 10 to 15 dilutions, or 1 to 5. So you can calculate that up, and that isn't even, that's got to be the imprint of it. It's not the, it's the homeopathic imprint. Of course, we wouldn't want to say we do homeopathy, but basically we do when you got that, Now we talked about the peripheral arterial disease in the small vessels. And, Parkinson's disease is linked to oxidative stress now, and is linked to chemicals. So when you get criticized for a diagnosis of chemical sensitivity, say, well, do you believe in Parkinson's disease? And they'll say, yes. Well, that's a chemical sensitivity. Multiple vaccines have now been associated with mitochondrial dysfunction, given them all at once. And of course, if you're going to give them, you should give them not in a tiny baby, but divide them up so you don't have to have all of them. And certainly you don't want to be totally anti-vaccine because you can't cure polio and it still occurs. And so you want to do that. Now this thing seems to be skipping. I don't know how we can do this, but acetylcholinesterase inhibitor is supposedly a preventative oxidative stress. But in my experience, if you don't remove the cause, it doesn't seem to work very well. And the pyrrostigmine bromide is a pre-treatment for them. They used this in the Gulf War. Didn't work very well. Yeah. I guess I could do that, couldn't I? Pardon? Yeah. Body irritability. How do I get that? Turns it off. Well, anyway, pardon? I know, yeah. The other thing is Gulf War guys got sarin gas, which nobody will talk about. It's in the literature. It's been written about. It was measured over there. And I had a lead pilot that went in from this. And he didn't get hit. He got hit by flak that came in his cockpit. And he's had brain damage all this time. And you know how all these Gulf War guys are talking about committing suicide, and a lot of them do? And I think it's probably from low gut mitochondria, they get depressed, and then they have, they get their brain screwed up and get the oxidative stress and inflammation, get hypoxic, and have the problem. Okay. So the other thing you can look for is decreased peroxidase activity, increased GGT, look for natural killer cells, look for PVO2. PVO2 is a venous oxygen without a tourniquet on the antecubital fossa. And your blood is supposed to come back extracted. It's not supposed to come back red. As a cardiovascular surgeon, we always knew that because you'd look down at the machine and say, well, is red blood coming back? And if it is, you don't want it. You want dark blood because you want the patient, you know the patient's in trouble if they got bright red blood coming back, you see. And same with trauma in any kind like that. Same with chemical sensitivity. The other thing is that natural killer cells are down, and then antioxidants are down. Heart rate variability for the autonomic nervous system is abnormal every time. The big one is increase in sympathetics, decrease in parasympathetics. That's the worst one. I call that a hyper sympathetic effect. But you can have all other parameters also. And it's a simple thing to do in your office. It's very cost effective. And we do it on most patients for that reason, you know. And I guess the other thing is autophagia, which we talked a little bit about, but that's the body's mechanism for clearing out dead, dying cells and debris. And 12 hours of fasting, in other words, if you have a patient eat once a day, you can help clear them out. And we'll do that on some people who are reluctant to fast. almost every major religion in the world has fasting, and I think this is a reason for it. And you can go, 4 or 5 days if you have to on the real severe patients. But it's a great tool to use. Physiologically, there are hundreds of papers written on it now, and when the so-called authorities come at you with things like that, you don't have to quote the Bible. You can actually quote some scientific literature, okay? But anyway, it's another tool that's good. We had 50 patients with chemical sensitivity that had fatigue, weakness, and brain fog. Almost all of these had muscle tenderness, joint tenderness, some swelling, short-term memory loss. They loss of balance. You can get that in the initial visit by having them stand on their toes with their eyes closed and with their eyes open, and have them walk a straight line with the eyes open and closed, and most of them can't pass the drunk test, Now, what we did besides avoidance, put them in controlled environments, 5 times less polluted, safe water, rotary diet, is that we use histamine, serotonin, capsaicin, and you can actually now use cinnamon and ginger as different substances that help stop nerve function. Since this is a nerve vascular function, immediately, anytime you got an injury, if it's in your nose going up to your olfactory nerves to your brain, which almost all chemically sensitive people have, and you got to remember that the people with electromagnetic sensitivity all have almost that, or cardiac injury. You got the vagus nerves, you got the sympathetic nerves injured. Histamine, serotonin, capsaicin, particularly the capsaicin will take care of that. You know that you got the immunological for histamine and serotonin. However, they can be non-immunological, and capsaicin is a amygdaloid receptor, and that receptor will be the non-immune part of your neutralization. So we do those on everybody who comes in as substances to stop reactions. So you can stop the reactions immediately. It'll only be temporary, maybe 3 or 4 hours, but they can do it 3 or 4 times a day if they need to, until they get their body equilibrated and get so it's not so hyperreactive. And so we try to do that, and then go from there. Now, massive avoidance, removal of all triggering agents is possible. Remember, natural gas and herbicide are the two, and I didn't hear either one of those mentioned in the earlier talks, so we want to include that on those talks. And glutathione and the nutritional substances, vitamin C, they're the big one. Now when everything else fails, and unfortunately, if somebody can figure out we can get this out, we can use T-cell replacement. There's a certain process that we've developed, but it's individualized. So you can't get a commercial lab to do it unless you have to have fresh blood to draw it, to make it. After that, you can ship it. Or gamma globulin, if your T cells, or if your gamma globulin's down. So I'd all urge you to look into the gamma globulin. And so in summary, the basic science of chemical sensitivity has now been substantiated by hundreds of papers and references. And one of the key factors in this is mitochondrial dysfunction. Thank you very much.
Dr. Ray, thank you, first of all, for your lifetime contribution to this field. It's been really amazing to listen to this short summary. One of the things that we face as clinicians is trying to figure out if an individual is at high risk. Like you, for example, you mentioned the sudden cardiac death.
Yeah.
Do you think that a combination of heart rate variability and end arterial nitric oxide measurement, which is easily available to us as clinicians,
Yes.
are good surrogate markers for that?
Yes, I would agree.
Okay. Any other very quick, in-office tools that we could use to determine an individual's resiliency in the moment?
Well, of course, just withdraw and challenge a lot of times will do that. You know, you have them avoid a food and, you know, let them go ahead and not eat for 12 hours and then hit them with a food they're sensitive to, or you can expose them actually to a mold if you have to. The other thing you can do is you can get urine mycotoxins from real-time lab, and that will give you a quick one. I think that takes 6 hours to do, and that would be one I could do. The other thing you can do, you know, if you really expose them to a little bit of perfume or give them some methyl alcohol or something like that, why you can do a quick and dirty one also. And of course, if you don't do the intradermal technique, which I highly recommend you learn, you can do it sublingual underneath the tongue and put different substances in there, and you can get a rough idea that you're on the right track, you know?
But in terms of determining their resiliency, their host response, and what their capacity is.
That's what I'm talking about, yes. And
Okay.
of course, most of them, well, you have a lot of different patients which walk in your office and you never know. And listen to them and they'll tell you. And a lot of times you can do simple things that they'll tell you, okay, and prove it. And that's what you want, is constitute proof, and then you know you're off to the races.
And in individuals that seem to be hypersensitive to trace minerals, like hypersensitive to magnesium, what does that...
This is a real problem. And if you don't face it, you lose part of your treatment because, as you well know, magnesium is a big thing for decreasing hypersensitivity. And you can do sublingual magnesium or intradermal magnesium and try to find a dose that you can get. Now, the other thing about magnesium is if they're constipated, give them magnesium oxide or mag sulfate. If some of them can want Epsom salts baths to stop the tremors, and some will do it that way, which is a fairly easy test to do, you know. There are about, I don't know how many different types of magnesium, and I would just go down the line until I find one that they can tolerate, you know, and then use that. But be cognizant of the fact that if they are getting hypersensitive, you keep repeating it, and there's very few guarantees in medicine, but you'll get them sensitive.
Thank you very much.
Always learning something from you. Always learning something from you, Bill.
Well, thanks. I do from you, too.
A couple of questions. What's your feel on fiber-optic cables in EMF patients?
Well, you know, they're reported to be better, okay? And some people seem to like them very well, but other people, they can't tolerate them. And, you know, I'm like Mary Ann Block here, you know, always got to listen to the patient. I don't care what and you know, I know you do that too. They're the authority when it comes to what their problem is. And so you got to listen to them. Most of the people seem to do better with fiber-optic.
I was intrigued with the capsation. You said it's on the megala receptor chemical?
There are a lot of receptors that are capsaicin. amyloid, now I got a
Amygdala.
fiber-optic one.
Yeah, we're both getting brain fog.
Yeah.
But I was wondering, how does
Amyloid
that play into
receptor.
Annie Hopper's stuff on limbic retraining? Because
May well be, and I don't
gotta-
know how well you can train them, but if there's about, I don't think there's about 8 or 10 of those receptors in the body interspersed every place. And they're all similar family, but not the same thing. And if you look at the formulas, they'll be somewhat the same. We're working on that, and I think in my new book it's going to come out.
Okay, thanks again.
Thanks, Dr. Ray. 2 questions. First one is, how do you test people for Wi-Fi or EMF sensitivity?
Well, there is a company called lessemf.com, and they have a lot of mats and different protectors that one can use, up to a bracelet, a shield, to a Fiber-Optic, or to a Faraday cage suit, and you have to judge the patient to do that, okay? The other thing is sometimes aluminum sheets will do it, and but not too common, but we have a lot of those on our ceiling. Sometimes copper will shield them, and silver will do it also. And we have one room that's made out of mostly copper, and then you can get the screens at the hardware, and the small bore ones seem to help. I like to use the EMF.com because I think they know more than I do about it. But then you can't resist putting a room up yourself, and screening the windows and so on.
So then you treat them, and if they respond well, then you know that they had an EMF sensitivity.
You have to remember that 80% of the people with EMF have food and chemical problems, okay? And so you treat that first. But if you're really treating the EMF with the avoidance always of these things first, I neutralize for all the minerals and metals because they're antennas. And something I didn't mention before, there are now 2,500 artificial implants in the body that can be used in the body, starting with the teeth. But the ones I see are multiple. They got artificial boobs, and they got artificial mesh, and they got bones that have been, healed, and it's hard to name all of them that we've seen now. And I think I urge you all to check that out, because that can be a real problem, okay? And sometimes it's the focus, and it's the total cause of it, the multiple implant syndrome. And if I get time in here in the next year or so, I'm going to write a book on that, because I learned that from heart valves 40 years ago. You have to anticoagulate middle heart valves, but you don't have to anticoagulate a human heart valve or a pig heart valve, so on down the line. So just remember that, that these things are antennas, and it's put the total load up.
Okay, thank you. And you mentioned that you can get mold spores out of a home, but it's hard to get mycotoxins out. How do you test for mycotoxins in a home?
There's a guy called Hooper, Real Times Lab. I think they're doing it now. They're the ones that did it in the urine, and it's been quite accurate in the urine, and we've neutralized for them and provoked with them. So I think there's going to be okay, because you can clean a house for mold and get totally mold-free, and people get sick in there because of the mycotoxins. We neutralize the mycotoxins.
Thank you.
There's a group called HBELC.org. It's
I can't hear you.
Healthy Buildings. There's a group of building engineers that will come out and help your patients. They will come out and screen for mycotoxins. They use the real-time lab. They use the things from less EMF, such as the Y-shield and the screens and things.
Yes.
They'll come and evaluate the person's home or workplace. It's HBELC.org. They have engineers that have all kinds of measurements.
Where are they located out of?
The headquarters is in Santa Fe.
Santa
But
Fe.
they have people all over the United States and the world. And they have free training courses to doctors to educate themselves about what's going on, or they help patients to educate about what they can do to help themselves with this particular EMF issues. They have people to give advice to get the the smart meters off the house, so that you can protect yourself, and all kinds of advice. They'll measure. Whenever you have three-way wiring, you've taken the positive and negative lines that cancel each other out, you've split it, and you've created a huge electromagnetic field that is really bad, and you can't sleep in it, you can't heal in it. They can detect that and then remediate it for you.
Yeah.
So I urge that. They also helped me with a case that I had. A lady was coming in that she and her daughter developed severe neuropathy and insomnia and anorexia when they switched from a Prius to a Kia Soul vehicle. And we measured and found out it had over 50 times the amount of radiation. And these people knew how to shield the car because the dealership wouldn't do anything about it.
Yes, they
And so-
won't. You're right.
So you can get these people involved and get some of your patients better if they can't do avoidance type things.
I'm with you, and I like to test them out.
Thanks, Dr. Ray, for sharing your great experience with us. I was wondering if you would comment about your experience with PEMF as a therapeutic modality.
About what?
Post-electromagnetic frequency therapy, PEMF.
I don't really know that I can really do that. We have done some, but again, what we've learned is every patient is sensitive to their own frequencies, different frequencies, and some you can hit it and some it can't, okay? And some are too unstable to do it. But it's another modality, and it should be looked into under controlled conditions, and people need to publish about it, okay?
Thank you, Dr. Ray. I just had a comment about trying to diagnose people who might be EMF sensitive, and one thing I've heard about is Dr. Toril Jelter. She works with kids who are autistic and finds that often they have EMF sensitivity. And what she advises, she has a calming behavior protocol that you can find on the web. If you just go to Dr. Toril Jelter, calming behavior in kids with ADHD. A lot of you are shaking your heads, you probably already know. But she actually has them turn all the wireless devices off in the house, all the iPads and cell phones,
we do
turn
too.
everything. Everybody probably already knows that here. But also, it goes to the extent that for 2 weeks, it's a 2-week protocol, and then you also turn off the circuit breaker to the bedroom so that they can sleep well. So
I would agree.
Anyway, that's her behavior.
The question is, what do you do with the neighbors?
Well, it's
smart
exactly the
meter?
problem, because then you get all that stray electricity. It's Dr. Toril Jelter. Her last name is Jelter, Jelter. First name is Toril, Toril. And it's called Calming Behavior in Children with ADHD, or ADA, attention deficit hyperactive disorder. And it's on Katie Singer's website also. Katie Singer has a website, Electronic Silent Spring, and you can find it on there too, Electronic Silent Spring. So,
Thank you.
thank you.
Thank you, Dr. Ray, for an excellent presentation. I'm Adrienne Sprouse. I have a practice in Manhattan for the last 25 years in environmental medicine. And I think it's hard to find a patient with EMF who doesn't also have chemical sensitivities, food hypersensitivities, medication allergies, etc. So in my experience, treating all of the others relieves them of their EMF. The EMF is not primary.
To a
It's
point.
secondary to everything else that's going on, so it's good not to look in the wrong place. Thank you.
Good.
I was wondering on your capsaicin, if you're using it are you using it as injectables for the
Yes.
neutralization? Do you think that it would be effective as sublingual
Yes,
also, since it wouldn't have to be as sterile?
to a point. Doesn't have to be sterile. You look at that big vein under the tongue there, and what you're hoping to is for it to absorb right away. And the sublingual treatment's about 85% effective versus
What would you mix
injection.
it with?
Yeah,
What would you mix it with?
I wouldn't mix it.
You just do straight capsaicin?
Straight.
Oh, okay. Thank you.
Yeah.